Hi, ladies. Welcome to Camille's Holistic Health Show. And my name is Dr. McClellan or Dr. Camille McClellan. And I help women with autoimmune and other chronic conditions with a more natural and holistic approach. And today I wanted to talk to you about uh, hormone replacement therapy and the different alternatives when it comes to, later on in your life, in your 40s and your 50s, when these symptoms start to pop up, especially uh, when we are focusing on a more, balanced life. We want the energy, we want to feel good, we want to have that mood and that level of vitality, daily, because women are doing so much more today. We are uh, really in the trenches building our businesses. A lot of women are wanting to do that, desiring more, having children, just wanting a family and being able to have it all. And going into these later stages of life, we still want to maintain an overall balanced life. And when it comes to, I've talked previously about conventional medicine as opposed to a more natural or holistic approach, alternative medicine. A lot of people are turning to these different approaches, integrative approaches to health and wellness because of the safety uh, around certain medications that are on the market today. And it has many people taking action, taking control of their health. And this isn't a time now to do the same. So, knowledge, like I said, I mentioned a lot, is power. And when you know your options, it's always great because you'll be able to make better decisions for your health and wellness. So, today I wanted to talk a little bit about hormones and aging and the different ways that you can actually approaches to improve these symptoms. Now, uh, hormone replacement therapy. We have synthetic, we also have bioidentical. Yeah, I'm sure you've heard of that name. Uh, a lot of health professionals see them the same way because they are made in a lab, even though bioidentical hormones are more plant-based, but they are still made in labs, and a lot of doctors prescribe them. However, they're still unsure of their safety when it comes to your health. So a lot of people are going or leaning more to even more natural approach. And I find this very, very empowering for women to take control of their health and their wellness. So when we are going into these, in our 40s and in our 50s, these symptoms often pop up, and a lot of women are going to the doctor even though they have these symptoms. Their labs or their blood levels, their estrogen, progesterone, are sometimes still not showing any imbalance, or it's not showing that it's low. Estrogen is not low, progesterone is not low, but symptoms are still occurring. This is because we are gradually, slowly going into that particular area. You're going into that area of menopausal, perimenopause is what we call it, between your reproductive cycle and then your menopausal cycle. So again, these symptoms can be very vague. as we know, because they show in many different ways. It could be depression, could be anxiety, could be low libido, lack of energy, and lots of other things like decrease in bone density. So with that, and again, night sweats is another, weight gain and bladder problems, okay? And when we are looking at the various bioidentical hormones or replacement therapies, they come in different forms. They come in gels, creams, pills, patches, injections. And women are, again, like I had said or had mentioned, are looking for a better approach rather than the synthetic and even the bioidentical approaches to their health. And when we are looking at more alternative ways, we could go doing many various things. And I'm going to talk about 4 ways I think it's really, really good to start doing now before many of the other symptoms start to occur. Okay? And I had mentioned quite a few. That's weakness, osteoporosis, weak bones, hot flashes, anxiety, depression around your mood, uh, uh, dryness in that area, low libido, and irregular periods. These are symptoms that occur gradually in our perimenopausal uh, area in our lives, usually, mid 40s going into our 50s approximately. And then when we hit the 50s area, then, well, the symptoms might occur more. But it's really important to take action, even though your symptoms might be mild, even though they are vague symptoms. It's always good to help support the levels of estrogen and progesterone, because uh, a lot of studies show that if they're not taken care of, it can lead to cardiovascular problems. It could lead to stroke and osteoporosis and just various other health problems related to hormonal imbalance. So I'm going to go ahead and talk about 3 or 4 ways that I think that you can benefit from hormonal symptoms and you can help your body in a more natural way. The first one is to reduce your stress levels. And I can't tell you exactly what different types of stress relief things you can do, because again, you're an individual, and it's great to find out what's best for you in terms of you as an individual in that respect. So stress levels and being aware of your stress can help you in so many ways. When you know that it's getting to that boiling point, don't wait for those times. Don't wait to take action and control your stress. Try to do it on a regular basis. And 2 is to increase muscle mass. And that is one way to help increase the amount of increase the muscle mass in your body and helping the density, the bone density, and this will lead to less symptoms of bone weakness in the body. So a great way is to increase the amount of weight with low repetitions. And again, it's great to implement this with yoga or some type of reduction or stress reducing exercise. And number 3 is a well-balanced diet. And I always urge my clients and my homeopathic patients to look into whole foods to help with estrogen and progesterone that's low as we age. And some great whole foods is flax seeds, dark leafy greens, bananas, nuts like almonds and cashews, chickpeas, olives, olive oil, and wonderful vegetables like kale and Brussels sprouts and alfalfa and yams. So take a look at those great whole foods because they really benefit your hormones. And number 4 is to get fantastic sunlight when you can in the summer, especially if you live in Florida or you live in another part where there's lots of sun. But if you don't, then it's great to supplement with vitamin D to help with balancing your estrogen and your progesterone levels as we age. So I wanted to just touch base again really quickly is to take control of your stress and do it before that boiling point occurs. And number 2 is to increase that muscle mass to prevent osteoporosis. 3 is a well-balanced diet, especially with more plant-based foods, and getting more sunlight and getting either a supplement of vitamin D to help with your hormones. I think it's really, really essential that we take a look at more natural approaches to health and wellness today rather than going to serious other complicated medications that can cause more harm than good. So thank you so much for watching, and make sure you subscribe to my YouTube channel and hit that bell so you can get notified every time a new video comes out. Thanks so much for listening, and I'll talk to you next time. Bye-bye.